Hey, this is Kim. Thanks for clicking on the video. Today I'm going to be talking about why your doctor might not know much about Parkinson's. Hello everyone, welcome back. And if you're new here, welcome to my channel. Have you ever visited a doctor for a new illness, mentioned that you have Parkinson's disease, and asked whether the treatment they're prescribing could interact with your PD symptoms or medication, only to be met with a blank stare? Or worse, have they quickly dismissed your concern, assuring you there would be no issues without really checking? The truth of the matter is, many doctors and medical experts don't understand Parkinson's disease. Why is that? Okay, so first of all, I want to mention that I am not a medical professional. I'm just a normal person. My mom had Parkinson's disease, and I did a ton of research trying to come up with things that would help her. So this information is things that I have learned through my research. Okay, so today I'm going to be talking about a topic that many in the Parkinson's community have experienced firsthand, I'm sure. The frustration of encountering medical professionals who seem to lack in-depth knowledge about the disease. Now, I'm not blaming doctors. This is about understanding the complex reasons behind why I think there is a knowledge gap, and how Parkinson's patients can advocate for themselves and ultimately receive better care. Now, let's be clear. I'm not talking about neurologists who specialize in movement disorders. They are, of course, the experts. But not all neurologists specialize in movement disorders, even though they treat a lot of Parkinson's patients. For many people with Parkinson's, their primary care physician, or even other specialists they see, might not have the depth of knowledge needed to provide specialized care. My mom had Parkinson's disease for years, but she only really suffered in the last year to 18 months as her symptoms worsened. It was incredibly frustrating that even when she was in the hospital, the doctors didn't seem to know much about Parkinson's. So why is this? Well, Parkinson's is complex and variable. It's a neurodegenerative disease with a wide range of symptoms. It's not just tremors. There are non-motor symptoms like sleep disturbances, cognitive changes, mood disorders, nausea, so many. They can vary significantly from person to person. Unlike diabetes, multiple sclerosis, or high blood pressure, which have diagnostic tests that are clear and easy, Parkinson's disease is diagnosed based solely on the symptoms that the patient is experiencing at that moment. Misdiagnosis is quite common, and the doctor you choose makes a huge difference in the treatment you will receive. Now, an example is one person might struggle primarily with rigidity, another faces severe fatigue, and a third may have cognitive issues. This variability makes it challenging for general practitioners to stay up to date on every possible manifestation. One major problem is that Parkinson's disease just isn't covered in depth in medical school. Most doctors only spend a few hours learning about the disease during their entire training. There is so much that the medical students need to learn and only so much time. It's unrealistic to expect the medical students to become experts in every field. According to the research I've done on the subject, the medical students only learn about the classic Parkinson's symptoms, tremors and slowness of movement, and they rarely would get exposure to real patients with any different symptoms. Medical school covers a vast amount of information. While Parkinson's is included, the focus may be on the more common presentations, which makes sense. Time constraints in clinical rotations mean that doctors in training have limited exposure to patients with Parkinson's, especially those with less typical symptoms. A medical student might see a few cases during their neurology rotation, but that might not be enough to fully grasp the complexities of the disease. Parkinson's research is evolving fast, which is a good thing. New genetic discoveries, biomarkers, and treatments are all emerging all the time, and new diagnostic tools are being implemented regularly. Keeping up with the rapid pace of change can be challenging for busy medical professionals, especially those who don't specialize in movement disorders. An example would be that a new study might show that the benefits of a specific medication, treatment, or exercise program, but it can take time for this information to disseminate and be integrated into clinical practice. And there are time constraints in clinical practice. The doctors have many patients to see and care for, and it's impossible for every doctor to specialize in every disease. Doctors, especially primary care physicians, often have limited time with each patient. This can make it difficult to conduct a thorough assessment of Parkinson's symptoms, especially non-motor ones. And they are under pressure to see a high volume of patients, which can lead to rushed appointments and missed opportunities for any in-depth discussions or diagnosis. Now, a 15-minute appointment might not be enough time to address all the concerns of someone, especially someone living with Parkinson's disease. I did some research, and the average appointment time is 15 minutes per patient. That's crazy. As we all know, the disease changes constantly, particularly in the advanced stages. The patient will have new symptoms, worsening symptoms, and many more issues to discuss with the doctor at each appointment. 15 minutes just isn't enough. And this is something I want to strongly suggest. If you are the Parkinson's patient or a loved one of the Parkinson's patient, that person should never go to the doctor alone. At the beginning stages, it's probably fine, but as the disease starts stripping away abilities, it's important to have someone come along to support the patient, to make sure all the questions get asked, and that someone understands what the doctor is prescribing and suggesting. Especially if you're seeing a doctor in a really busy clinic and the doctor needs to go through things quickly, Parkinson's patients' needs are much different than those with other illnesses, because many of them have cognitive problems as well as slowing down of speech, slowing down of movement. And without someone there to help them through that appointment, a lot of things may get overlooked. Now, another issue I see is that there are not enough Parkinson's disease specialists to go around. Only a tiny percentage of neurologists are actually movement specialists, movement disorder specialists. You may only have access to a general neurologist, however, and this person is seeing patients with epilepsy, multiple sclerosis, headaches, Tourette's, migraines, example, and probably does not have the specialized training or expertise in Parkinson's disease. My mom's doctor fell into this category. He treated Parkinson's patients, but he didn't have the extensive expertise that my mom really needed. Looking back, it was very frustrating for us. But now that I look at the situation with a different lens, I see that he wasn't really the appropriate doctor for my mom. He didn't have the education or experience needed to really help her in the advanced Parkinson's stages, beyond prescribing medications and suggesting specialists for her to see. It's common, though. And in some rural areas or smaller medical facilities, access to movement disorder specialists can be quite limited. This means that general neurologists or primary care physicians may be the main source of care for Parkinson's patients. While they do their best, they may not have the specialized knowledge and experience of a movement disorder specialist. Someone living in a remote area might have to travel long distances to see a specialist, or might rely on their local doctor for most of their care. My mom needed to see a movement disorder specialist. We tried to get in to see one and did have an appointment. Wait, let's back up a minute. I want to tell you the story. So back in November of 2024, she had a TIA, a mini stroke. And that started her symptoms intensifying, and new symptoms and issues were arising constantly. Up until that point, Mom was living independently, and her Parkinson's disease was really just a mild inconvenience at that point. But once she had the TIA, it quickly got worse and fast. Within 2 months of the TIA, she was 100% unable to live by herself any longer. I did find a movement disorder specialist down in Los Angeles who was highly regarded, popular, and seemed like a great fit. I called to make the appointment for Mom, and the soonest appointment I could get was in November of 2025, almost an entire year later. I asked about getting on a waiting list, and she said sure, but there were already pages of people ahead of us on the waiting list. Sadly, Mom passed away before she could benefit from the care from this movement disorder specialist. So we never got to see him. I really think if we would have found him earlier, I think he could have changed the trajectory of her disease and her suffering. Anyways, my mom passed away in September of 2025, so she never got to see him. Her appointment was in November. Okay, so what can we do? Well, you can advocate for yourselves. Education, keeping good records, sharing information with doctors, and my biggest suggestion is to find a specialist before it's too late. So, educating ourselves, learn as much as possible about Parkinson's. I spent hours and hours researching everything about Parkinson's disease. I have a bunch of videos planned to share with you. Like I said, I'm not a medical professional, but I feel like I have a good amount of useful knowledge to share. I researched every single symptom my mom had. I would research all the medications, the possible treatments, the possible causes, the possible outcomes. I have a lot of information. Sometimes I felt like I knew more than the doctors. Not her neurologist necessarily, but the other specialists. I would have to tell them about potential drug interactions or symptoms that may be associated with the Parkinson's that could affect whatever they were looking at her for. To me, knowledge is power, and I encourage you to subscribe to my channel where I plan to share everything I have learned. And believe me, there's a lot of it. My next thing that you can do on this list is to keep records. Track everything. It's really a game changer. One of the most important things you can do is track your loved one's symptoms and medications. I kept a daily planner and we wrote down everything, and I mean everything. This really helped me pinpoint what was happening with Mom and helped me find ways to help alleviate some of it. So some of the things I added were: what time did she eat? Did she have physical therapy? Did she go for a walk? Stay in bed all day? What was her blood pressure? What time did we take it? What medications did she take this day? What dosages? If she had a UTI, what medication was prescribed? She had a lot of urinary problems towards the end, so she had UTIs and other things going on, which was very uncomfortable for her. It's a very common symptom of Parkinson's disease, especially as it advances. Was she nauseous? Was she constipated? Did she have a headache? Did the headache bring on any confusion? Did she have hallucinations? If she did, what time did they start? How long did they last? What sorts of things did she see or hear? The more details you can give the doctors, the better. I was always looking for patterns, trying to figure out what was triggering certain symptoms. It helped me so much in managing her care. Trust me, this kind of tracking can make a huge difference. Bring your planner, this information that you've gathered, to every doctor's appointment. Bring a list of symptoms. Bring a list of questions. The more you share with the doctor, the easier it will be for him to help you. Share relevant articles or research that you might find. The doctor may or may not have read what you gave him, but he is so busy seeing patients all day, doing his paperwork, making calls, etc., he may not have time to find these things on his own. So share it with him. Seek out a movement disorder specialist. Like I said, this is probably my biggest suggestion. There may be a long wait to see one, like the wait my mom was experiencing. It's frustrating that there are not more movement disorder specialists around, but once you get in to see one, you may have more specialized care and a better outcome. The last thing I want to say is communicate clearly. Be specific and detailed about your symptoms. Keep track of every symptom, if they are getting better or worse, and any new ones that pop up. Hopefully your doctor will address them and have solutions for you. We can also advocate for better medical education. We can support organizations that are working to improve training for medical professionals. To be honest, I have not researched any of them yet, but if you know of any organizations that focus on better training for doctors, let me know in the comments below. And like I said, I'm not trying to blame doctors. It's not their fault. There's so much information out there, it's impossible for them to know it all. It's important to remember that most doctors want to help. By understanding the challenges they face, we can work together to improve the quality of care for people living with Parkinson's. Thank you for watching. Please share experiences in the comments below. Don't forget to give the video a like. Please subscribe and share the video with anyone you would feel would benefit from this information. I'll see you in the next video. Stay healthy.